Chair.
Barbara
Mr.
Stewart.
Chair. Thank you, Mr. Chair. I'm very pleased to take a call in the estimates debate. At this point in time, Mr. Chair, New Zealand First is appalled at the way that the health system is being managed. The focus is totally on outputs rather than outcomes, and this is being actively encouraged by the government. Ensuring that the numbers are right, and we hear a lot about the numbers, is not the best outcome for people who are waiting for operations and assessments. People are being shifted around on the waiting lists for years, having their cases reviewed regularly within the 6 months, but there is no action, no real attempt to get them off of the waiting lists. Yet, the overall view, and we've heard it from Dr. Hutchinson, is that hospitals are meeting their output criteria. There is no thought of outcomes for individuals. One lady that I was talking to over the recess is waiting for a cataract operation. She started waiting 2.5 years ago. She's now fearful that when she goes to sit her driver's licence later in the year, because it needs to be renewed, that she's going to fail because she is unable to see as well as she should and unable to see as well as she could if she had a cataract operation. Today, I also got a letter from a gentleman who is waiting for a cardiology test. Semi-urgent has been the classification that's come back from the hospital. Although, and I quote from the letter, although your referral is semi-urgent, we are unable to offer you an immediate appointment. However, it is our intention to ensure people do not wait longer than necessary, and with that in mind, an appointment time will be forwarded to you by mail as soon as it's practicable. When is that appointment time? The 2nd of January 2014. This letter was actually written by the Mid-Central Health in May, 16th of May 2013. Now, is there any guarantee that that gentleman will still be around in 2014? As he said, he has paid his taxes, he has never been to hospital and asked for an operation, but he really believes that he needs this operation, and it sounds as if he should. This is a totally appalling state of affairs. How many other people are out there in exactly the same situation that have not contacted anybody? In New Zealand First, we would say that many people are sitting and waiting patiently, trying and struggling to get the care that they need from the health system. Surely it is far better for people to be able to get out and about rather than sitting at home with all of the problems that can create. We need to keep people active and involved in the community. We hear enough about the horrors of rest homes, but making sure that the statistics are right and they read well is not helping people. And the second issue that I want to bring up is the issue of hepatitis C. The government doesn't even seem to consider this to be a priority, which is absolutely horrifying, considering the lack of concrete data about hepatitis C infections in New Zealand. We acknowledge that the national community support programs are really great for New Zealanders already infected with hepatitis C, and we would like to see these progress. But infection control standards for unregistered tattooists and youth-focused awareness programs on transmission are needed to reduce the number of new infections. The government are focusing on being the ambulance at the bottom of the cliff rather than at building a fence at the top. The government needs to take this opportunity to regulate the back alley tattoo industry rather than sit back and wait for disaster to happen. Basically, we believe that people are far more important than statistics on throughput. And this seems to be the health record of this government, which is appalling. Just recently, talking to some young medical first-year students, first-year graduates, they can't get a placement in the DHBs, which is appalling to complete their qualification.
Order. Dr. Jane Yang.
Mr. Speaker, according to OECD, Mr. Chair, according to OECD Better Life Index, when asked